probably never leave me. And it was not necessarily in my treatment, but in the treatment of somebody else that I observed. This is this person who's unable to speak. And she's, having that treatment. They have lasers, they have music going. And I think the whole office came in and started singing this song together to encourage her to be able to speak. And you just don't find that everywhere. That compassion for someone, and that the uniqueness to come and want to be a part of it and sing with joy and love, like that will probably never leave my mind. Like I honestly, I got goosebumps when I was watching it, and I thought, oh, God is most definitely present here.
So as a caregiver, you hold so much of their trauma in yourself. For me personally, I was trying to take his trauma, trying to take his pain, trying to take all of that into my own body so that he didn't have to feel that. And I thought that I had let it go, but until I sat with Dr. Jerry, I had not let go of it, obviously, because I still felt that tension in my body. But as soon as she did that to me, it was like a full release of just everything. And I let out a huge breath, and Jaden let out a huge breath at the exact same time that I did. We're so connected that if I let my trauma go from this situation, he'll feel that trauma leave his body too. And then he can feel the peace, then I think he has the opportunity to heal.
We have some new technology. This is SoftWave. I'm extremely excited about this for multiple reasons. We're one of the first clinics in the world to be using it for brain applications. I've had some firsthand experience on some amazing regenerative capacity with this machine on what it can do for the brain, restoring function extremely quickly, getting people out of pain faster than I've ever seen before. I've literally seen, even this week, I've seen primitive reflexes literally inhibit or integrate faster than I've ever seen before when we use it on the brain, but then also specifically for those primitive reflexes. We're the first to do it, that kind of application, which is really exciting. We'll continue to do some pilot studies. We're working in collaboration with SoftWave to do those research studies. So extremely excited. We're also using this now in combination with our B-cell procedure, using it before and after to help enhance the stem cells, which it is clinically proven, but also proven in the research to enhance, upregulate that stem cell response. So very excited about that.
Yay, can you hear me? Excellent. I'm going to type that in for me. Thank you everyone for coming. I know we had lots of good options for this hour, so hopefully you'll leave here and feel filled with the knowledge and pathophysiology of brain injury, and then also feel equipped that there are some different tools. I mean, this resource fair is all about tools with how can we improve our kids' trajectory after that they have brain injury. And it's multifactorial. There's not just one pathway, there's multiple pathways. So hopefully with me, you really understand the pathophysiology, which means physiology of something that happens that goes aberrant in human anatomy. So let's get to it. My disclosure is I do own Neuronutrients. We have a booth out there. Hopefully you'll come and see us afterwards. And who am I? I think it's always good to establish credibility with your audience. This is not to toot my own horn, but it's really to tell you that I'm pretty qualified to give this talk. I am a doctor of nursing practice. I'm a pediatric nurse practitioner, and I have a lot of specialties. I specialize in functional medicine. I specialize in clinical nutrition. And in fact, we founded one of the first pediatric functional medicine practices in the state of Texas about 11 years ago. I founded Neuronutrients about 3 years ago, and my specialty in clinical practice is kids with chronic disabilities. Autism, anxiety, OCD, chronic eczema, chronic bowel, chronic sequelae after brain injury. So there's this thing called the translational gap of medicine, and it's very long. It means from what we know to how we practice, it's about 17 years before we change any policy to how we change behavior in medicine. The classic example of this is we knew that we should put our babies on their backs so they didn't die of sudden infant death syndrome about 20 years before it became policy with the American Academy of Pediatrics, before we actually did it. So as we're learning new scientific things, they have to be translated into practice. And what you'll find here at this conference is there's lots of early adopters. There's just some physicians and providers out there that they are not going to do it unless it is in the algorithm of cookbook medicine. And then there's other ones of us that say, hey, this is evidence, we're seeing it, there's an abundance of literature all the time, and we're going to see the outcomes, translate it early, because we don't have time to wait this 17 years to improve clinical outcomes. So today we're going to talk about what happens after brain injury. How can we support our little people and restore balance in their brains? And how can supplements and nutraceuticals play a role in that? Okay, so we're about to get really sciencey. And I'm going to try to make it as simplistic as possible. So there's 2 phases of brain injury. The first phase is when the injury occurs. It happens when you have impact and there's tissue damage and there's impaired tissue and blood flow to the tissue. We have a disruption of the cellular membranes of the tissues of the brains, and then that causes neurotransmitter dysregulation. We have more calcium and glutamate in and out of the channels within the membranes, and then we have something called proteases that go and they break down cellular structures. As this is broken down, we have more of stress within the cell. That's also known as reactive oxygen species. So the more stressed out a cell it is, the more there's programmed cell death called apoptosis, and then we have death of the cell. But then the inflammation and injury continues. So after the acute injury, there's secondary effects to traumatic brain injury. We have disruption of the blood-brain barrier. Who's here heard of the blood-brain barrier before? Yes. So it is postulated that there is less impact in our brain because we have a barrier, we make it harder for things to get through. Our brain is an essential organ in our body and we want it protected. But some things get through the blood-brain barrier and they excite the brain and cause it tissue injury. Injury activates something called the microglia. So microglia are resident macrophages of the brain. They're these little guys that like to go and find cellular damage and eat it up. But part of doing that is when microglia are activated, you have more glutamate transmission in the brain. Glutamate is excitatory. So we've all heard of neurotransmitters. Serotonin, happy, calm, dopamine, focused. But glutamate is actually our #1 neurotransmitter in our brain, and it causes hyperexcitability. We need a degree of glutamate for our neurons to talk to each other, but too much glutamate can cause excitotoxicity. Changes in the balance after brain injury and that inhibition and excitation is something that often results, causing more of the neuronal dysfunction. So, when we have too much glutamate in the brain, what ends up happening is you start breaking down cellular structures. So every cell of the brain has a phospholipid membrane. And every phospholipid membrane also is in every organelle within the cell. Your mitochondria, your ribosomes, etc. When we have too much of that injury and inflammation, that now our cellular membrane is disrupted, so now more things are flowing into the cell, and then we have more reactive oxygen species, or more oxidative stress within the cell. And so when the cell again feels the danger and it becomes toxic, it dies. And the thing is, it dies, and then when it dies, the macrophages again get excitable because they're like, there's tissue injury, we have to go and clean it up. So again, they start dumping out more glutamate. So it is this cycle of glutamate excitotoxicity after injury. Here's a schematic of primary brain injury and secondary effects of TBI. And what I want you guys to really come home with is there's the initial injury. But after that initial injury, there's ongoing neuroinflammation that can become chronic. So let's break it down very simplistically because I want you to understand when you leave. We have a brain that becomes inflamed from injury. The cell structures break down. The brain gets into a hyper-excitable state. Continued excitation, or that hyper-excitable, leads to more neuroinflammation. That inflammation gets into the cell. It causes disruption within the cell, which eventually causes disruption of the mitochondria, and then we have cell death, which creates more inflammation, more macrophage activation, and on we go. So, what can we do about it? Well, our goals for treatment are to address the inflammation and oxidative stress, repair the membranes as best as we can, support myelination, support that excitatory inhibitory balance, support the mitochondria, and foster growth, repair, and homeostasis. So our first goal, address inflammation and oxidative stress. So we know, after just going briefly over the pathophysiology, we are expected to see continued inflammation in the brain after brain injury. But here's something, as a functional medicine person, as a functional medicine provider, there's so many other sources of stress that our kids, regardless of brain injury, can go over, and that we humans that live in this world are going under too. So there's infectious sources of stress, right? When your kids get strep throat, when you get COVID. So the sources, I know often many of you in this room have had trouble with their kids' gut after brain injury. Well, your gut has to be colonized in different ways to work well. And you can have an overgrowth of dysbiotic flora or bacteria that's in there that shouldn't be, viral pathogens, fungal pathogens, even protozoa, like parasites. But here it is, we also have all these non-infectious sources of stress on our bodies. You know, environmental toxicants. We're eating mostly processed and packaged foods that really aren't foods, they're fake foods. And they can have things like heavy metals, environmental pollutants. We could be feeding our kids foods that they're sensitive or reactive to. And we also could be feeding our kids vegetables and then they're full of pesticides. So potential sources of inflammation, all of this can come from it. How well our gut is balanced, we have this crosstalk via the vagus nerve. In traumatic brain injury, the vagus nerve is compromised. So balancing our gut is something that can be incredibly important as well. And here's what's typical about probably every one of the kids in here and every one of their siblings, because it's very, very common if you're feeding them the standard American diet. Often they're low in iron. Do you know that you need iron when there's injury? Iron is so important in your body. We have specific stores called ferritin in our body that we store it. And when there's any type of oxidative stress, we use up our iron. I really hope that everyone's pediatrician in here checks your child's iron because they've been under some stress and they're probably overutilizing their stores. And if you're replete in iron, you need iron to grow. You need iron to make all of your neurotransmitters. Often you can see kids have low iron with different symptoms like fatigue, restless sleep, kicking around their legs, jerking movements. Zinc is another one. It's a mineral that you can often see with the nail exam. Now, not if you have the nails and shellac and all of that, you can't see it. However, if you look at your nails now, is there ridging? Is there spooning? You know, what's going on with your nails? It's a really good sign if you have a mineral deficiency. Magnesium can be deficient and you can have problems with constipation, muscle twitches, poor sleeps, anxiety. And then a big one is essential fatty acids. We're going to talk a lot about fat because fat is the number one nutrient in this room that your kids need to help their brains grow and thrive. Fatty acids can be, for kids, it can be low cholesterol. So when I do cholesterol panels on kids, I want to see it around 170 total cholesterol. Most cardiologists say, oh, let's get your cholesterol at 130 or lower. No, our kids need cholesterol for their brains to grow, period. They can also have dry eyes, dry skin, get that chicken skin called keratosis pilaris on the outside of their arms. That can be an essential fatty acid deficiency. Omegas are so critical to the way that your brain is growing. So omegas not only provide antioxidant support, they counteract that reactive oxygen species, that oxidative stress in the brain. It also protects membranes. It aids in the way that your brain grows, and it can cross through the blood-brain barrier. So it's allowed to cross through because it nourishes the brain. It's really interesting. So this right there, if you look up that study, it was a study where a bunch of people were in the hospital getting standard of care treatment after brain injury, and they gave these patients, in one group standard of care, in the other group they gave them 8 grams twice a day of omega-3 fatty acids after brain injury, and everyone in that group had improved outcomes right after brain injury. So omega-3s are really important. So when you look at the back of your omega, you can see it's usually EPA and DHA. So that's an omega-3 fatty acid. We know that there's this robust, long history of treatment for ADHD, treatment for depression, treatment for autism. I can pull up study after study after study showing improvements with giving omega-3 fatty acids in the brain. And do you know the predominant fatty acid in your brain is DHA? In fact, DHA is 40% of our brain's lipid content. Often I'll run omega-3 fatty acid index on my patients, and here's what I want you to see. So you see up there it's low. So here's this kiddo's omega-3s, and here's this kiddo's omega-6s. Now this ratio is supposed to be 4 to 1. We're about at 11. So less than 4, it's been proven that we have an anti-inflammatory lipid picture in our body. The standard American diet there, if you're not doing anything to change your kids' diet and you're just feeding them the standard diet, it's usually, the 6 to 1 ratio is usually 25 to 1. That is very pro-inflammatory. So where do we get omega-3s? Well, we get them from cold water fish, salmon, mackerel, tuna, herring, sardines, also known as smash fish, flax seeds, chia seeds, and walnuts. You would be really surprised at how many kids will eat sardines. You would be shocked. But I have many patients that are like, oh yeah, our kids eat sardines. It's part of their diet. And I'm always like, wow, that's amazing. But if you never try, how will you ever know? It's a great source of omega-3 fatty acids, plus it's a great source of calcium because you get all those little bones in there. Omega-6 sources, typically we have a lot in our diet, right? They come from grains, processed vegetable oil, and corn oil, and seed oil. So typically, when you're trying to shift the ratio, you lean into omega-3, DHA and EPA. It doesn't mean that other things don't work for neuroinflammation, because certainly they do. And here's the thing about functional medicine and clinical nutrition. Steroids work, and they need to work. and they come with consequences for long use over time. So usually in functional medicine, we say, well, let's use a basket of things, because if omegas work, great. Can we put a little bit of resveratrol or quercetin, or really good forms of turmeric to get an anti-inflammatory effect? And in this type of medicine, it's usually not just, I give my kid one thing and they're all better. It's just like you sit down and eat a plate of food. You have your chicken and your grains and your vegetables and your fruits. We need a variety of things to get back to homeostasis. So how do we repair the cellular membranes? Well, here is a cell, and there's the cell membrane. And what I want you to take home is the cell membrane is filled with three primary things: phospholipids, plasmalogens, and cholesterol, omegas. So remember, oxidation means stress to the cell membrane. When you have oxidation, it can break down the cell membrane, and then it can disrupt neurotransmission and have something called impaired autophagy. So autophagy is a word in medicine that means how well do we clean out intracellular debris. And we're good at autophagy. You know what helps autophagy? Is when we sleep well at night and we fast for 10 or 12 hours. We're doing the autophagy. If you're constantly eating and you have no time-restricted eating, your autophagy typically is going to be more poor. Now, take a sweet little 3-year-old. You're not going to say, hey, we're going to go on time-restricted eating and you're only going to eat in a 6-hour window a day. That would be ridiculous. But hey, what about not a snack before bed and sleeping 10 hours a night? That's a beautiful time for autophagy in a 3-year-old. So what are these things, plasmalogens? One thing that I love about neuroscience is we're always learning more and we're always incorporating more. So remember back in this picture, that is the plasmalogen. It's part of the phospholipid membrane. And plasmalogens are these distinct phospholipids that are essential for our structure in our brain. They're high in vital organs. So I talked to one of you in the audience, I believe that their child is having heart surgery in a couple of weeks. To repair from heart surgery, having those plasmalogens in that little child's body is going to completely expedite healing. You know, in nature, the only place that anyone can get a plasmalogen is through breast milk. That's it. In fact, we eat plasmalogens from animals, and they get degraded by our acidity in our stomach, so we can't actually ingest them. Recently, a PhD physician out of Canada, he's not a physician, he's a biochemist. His name is Dr. Dalen Goodenow, and he created the first ever plasmalogen precursor that can survive the stomach acidity. And what's so beautiful about that is it was on target for Alzheimer's, and it was going to be approved as a drug. And Dr. Goodenow pulled it out and said, this is pleiotropic. It has many indications because plasmalogens are abundant in our nervous system, in most of our organs. They have so many different functions. And so he took it off the market as a drug and he made it over the counter. I've been using plasmalogens for the last couple of years in practice, and it has pushed the envelope to healing in many different ways. Phospholipids are a big, big deal. Phospholipids are part of that membrane level bilayer, the lipid bilayer. They're in every single cell in our brain. Omega-3 is highly dependent on getting into that plasma membrane, depending on how many phospholipids we have. In fact, in almost all brain injury, almost all neurodegenerative disease, almost all neurodevelopmental disease will give high levels of phospholipids like phosphatidylcholine because it can improve brain outcomes. Because part of what it's doing is helping get the omega-3 fatty acids. So proteases, remember, are those things that can break down phospholipids. And again, we know that that's very common in brain injury. So the most abundant phospholipid is phosphatidylcholine. It enhances neuronal differentiation under inflammatory stress. It increases population of our healthy neurons, and it modulates neuronal plasticity while helping us make acetylcholine, another neurotransmitter that is very important for neurotransmission in our brain. So here's a little schematic on choline-containing phospholipids, but I want you to notice the egg. That is nature's source of phosphatidylcholine. It's our most abundant source. So, you know, I've been around for a while, like when the 100-calorie packets came out and you counted calories because that's how you lost weight and stayed thin. Forget all of that. It's absolutely terrible nutrition science. Don't do an egg white omelet. Do a full omelet with your choline from your egg yolk. That has beautiful cholesterol in it and beautiful choline in it, and it comes from nature. I have a friend that's a physician out of California, and he has the exclusive contract with the military for our most elite vets that are injured. So all the, you know, I don't even know, they're up there. And they come back with brain injury from blast injuries or being overseas, and first thing he does is put them on 6 eggs twice a day. 6 eggs. And you better bet he's not checking their total cholesterol and telling them they're going to die of heart disease because they're eating so many eggs. So this is the last really sciencey slide, but just hang with me. So myelination is really important in our young kids. So how we myelinate the brain, most of it happens by the time we're 8, and the first 2 to 3 years of their life, you're myelinating. And what it is it's like, have you ever had a puppy chew the wire of your thing? You know, plugging in your phone and it's on the wall, but the wire's gone, so nothing's happening. You're not getting any voltage to your phone. It's like a glitch. Your myelination happens from these cells called the oligodendrocytes. Oligodendrocytes help wrap that myelin sheath, and then that axon, if it's well insulated, you're getting communication from one neuron to the next. So myelination is really, really important in neurodevelopment. And so we have most of our myelin, and then we have a period of pruning, and then we have cognition that ensues. And so one of the core features of autism is there's aberrant myelination. Well, why in autism? Because autistic children have tons of neuroinflammation. Well, guess what? So do kids with traumatic brain injury. So we should all be paying attention to myelination. And how can we help these oligodendrocytes do their job? We have to decrease inflammation, and we have to support our phospholipids and our plasmalogens in our brain. And plasmalogens are known to be the #1 thing to help with myelination. So I'm not making it up. Here it is. Here's all the science. Okay, so our third goal. So what about this excitatory inhibitory state in the brain? GABA's inhibitory, glutamate's excitatory. Brain injury, remember, activates those microglia. Remember, the microglia love to dump out a lot of glutamate, which causes a lot of excitotoxicity, and that causes injury to the cell, which causes neuronal membrane, brain remodeling, problems with neurotransmission, which eventually causes problems with the mitochondria and death of the cell. So I love this slide, and you know, I was printing it out and sending it to patients, and then I realized nobody really cares as much as I do, but I think it's really amazing. It's just nice to look at it. So here's the blood-brain barrier. And when you have a leaky blood-brain barrier, here's something coming through. A macrophage is coming through, and it's exciting this cell here, which is saying, oh, I'm going to dump out so much glutamate. I'm excited. The macrophage is coming through. There's a danger response, and all of a sudden, we're going to have more and more inflammation through glutamate. And look, there's that oligodendrocyte. The oligodendrocyte is going to have dysfunction. It's going to go into the synaptic cleft, dump out way more glutamate. And so this is presynaptic and postsynaptic. In the postsynaptic terminal, you're going to have all of this hyper-excitability. So people that have too much glutamate in their brains are going to have a lot of different things happening. Seizures happen from too much glutamate. Stimming and autism, if you've ever seen somebody stim, anxiety, skin picking, trichotillomania, hair pulling. You can have obsessive compulsive disorder. That's a very high glutamate state. And so when it gets over here and it becomes excitatory, what ends up happening to those sweet little astrocytes is your brain starts to remodel and you're actually stuck in this postsynaptic excitatory loop. So what we have to do is how can we change that inhibitory excitatory balance? Because high glutamate status is an irritable, anxious, non-sleeping child that has too much glutamate that we can clear. And this is a really interesting study. So it was development of seizures post-traumatic brain injury, a retrospective study. And what they showed is the milder your traumatic brain injury, the less you're going to develop seizures, right? So 1.5% in mild TBI, 2.9 in moderate. Look at that, in severe TBI, it's about 17%. So many children will go on to develop seizures. And why? Why do they develop seizures? Well, they have too much glutamate. It's that GABAergic inhibition that is lost. So GABA isn't doing its job to keep things low. There's gliosis or scars from the injury in the brain. And there's also, remember we've talked many times about apoptosis, that neuronal loss, that cell death. So you're more likely to go into a seizure disorder. So how can we clear glutamate? Well, there's many drugs that can clear glutamate. Antipsychotic drugs can be helpful for it, some seizure medications. But if you're not ready for that, there are things from nature that can be very helpful, like magnesium. Magnesium, we could have a whole day seminar on magnesium. It would be really fun, and you'd really know your magnesium after that. Plays a role in over 300 things that we do in our body. It's fundamental for our brain to have this ionic homeostasis, the balance between calcium and magnesium influx in and out of the cell. It helps maintain nerve and muscle electrical potentials, and it helps us with impulses across that neuromuscular junction. It's fundamental. Magnesium is a fundamental mineral for our brain. And guess what? Here's an amazing thing. It can help you grow. So modulation of brain-derived nootropic factor, that's growth hormone of the brain. It can happen with this GABA agonism, so the excitatory balance in the brain. It can help block NMDA receptors, which is also part of that glutamate excitatory inhibitory balance. And it also can be protective for the blood-brain barrier. So we can feed our kids magnesium. We can feed ourselves magnesium. We can take our pumpkins and carve them up and take all the seeds out of them, roast them, and have a magnesium feast after you're done, and it will be delicious. So pumpkin seeds have the highest magnesium of all foods. Isn't that awesome? So pumpkins, almonds, spinach, cashews, peanuts, black beans, etc. The list goes on. But here's what I want you guys to know about magnesium. There's one form that gets through the brain the best. So, who's ever used Calm? Yeah, okay. That's ionic magnesium citrate. It draws water into the bowel so you can poop. That's what it does. They have very, very wonderful marketing that you're going to be calm from it. But maybe it's because you had a great bowel movement and you feel calm. So usually, the magnesium that gets through the brain is magnesium threonate. And I'll tell you why. So there was really smart scientists from MIT in 2010 that took a magnesium molecule and put a threonate molecule with it. And they saw, for the first time ever in history, that magnesium that we ingested didn't get through the brain, and now all of it is getting through the brain because they have this specific molecule that's the carrier through the blood-brain barrier. And in fact, they did such a good job that they patented it. So there's a use patent on it. It's owned by a company called Magceutics. So they literally have the patent on the form of magnesium that can get to the brain. If you are selling magnesium threonate, or say that you're using magnesium threonate and it is not Magtane, they will send you a cease and desist and they will send you a letter saying you're using our product, you don't have permission, and we're going to sue you. So if it doesn't have Magtane on the label, and they won't sell it to anybody, by the way, that isn't using it in a therapeutic dose. So they actually saw 72 milligrams of elemental weight of magnesium is an anxiolytic dose. It helps you sleep. It's very impactful for the brain. So any product out there that's magnesium, that's not Magtane, that isn't at least 72 milligrams a dose, guess what? Probably not Magtane. So very, very important for you to know. Another thing that can decrease glutamate and help with that inhibitory balance in the brain is N-acetylcysteine. So NAC is it's one of my favorite antioxidants ever. In the hospital, we can nebulize it for people that have obstructive pulmonary disease or sickle cell anemia, and we can have it become a mucolytic. If you decide that it's time to go and you take a bottle of Tylenol, in order to rescue you in the ER, you know what we're going to give you? IV N-acetylcysteine, and it will save your liver and it will save your life. N-acetylcysteine is also beautiful for the brain. It's known to decrease glutamate in the brain, but dose matters. You have to give it at the right dose in order to have this glutamate modulatory effect. But it's beautiful. It's great for COVID and flu. It's good for viruses. It's good to protect your upper airways. It's good if you have a glass of wine for your liver. It's been shown to do many things: reduce tics, help with anxiety, and to decrease glutamate. So the dose matters. In adults, it's 2,400 milligrams a day. So it's like, well, what would you do for a 3-year-old? Well, for a 3-year-old, I'd probably give 600 milligrams. This is the tricky thing about NAC. If you cannot swallow a capsule, it tastes terrible. I mean, terrible. So there's pretty much only one person other that makes it, and it's pure encapsulations. They pair it with glycine, and they make it into a powder. That's okay. There's been some products on and off the market that have come and go that try to do it in a chewable or other forms, but it's best if you can swallow it. If your child is on a G-tube or a feeding tube, you can put it in their bag and they'll never know, which is preferred. So another thing is B6. It's the one last nutrient we're going to talk about that can really decrease glutamate in the brain. B6 helps you make your GABA. So because GABA is inhibitory, guess what? It needs a cofactor, and B6 is a big cofactor for GABA. It helps regulate other things such as serotonin and dopamine as well. There are some genetic defects that if you have a B6 gene, you might metabolize it really quickly, so bigger doses are needed for you. Deficiencies in B6 have been correlated with many, many different things, including seizure disorders, carpal tunnel, depression, MSG reactivity. You know why? MSG is delicious. I mean, it's just great. I mean, your brain just loves it when you're eating it, typically. It's really bad for your brain, though. Causes more seizures, can cause headaches. It's in most Chinese foods, unless you know and you ask for no MSG, and then maybe or maybe not it'll be in there. B6 decreases glutamate. MSG is monosodium glutamate. So you're just giving your brain more glutamate. So B6 has been known to help with hyperexcitability and aggression. We've studied this in kids with ADHD and autism. But here's what I want you to know. Most kids that are on seizure medications, in particular a medication called Keppra, it depletes B6 from your brain. So actually, anybody on Keppra needs to be replaced, needs to be on a replacement of B6. And not all B6 is created equal. So there is pyridoxine hydrochloride, and then there's another broken down form called pyridoxine 5-phosphate. That's the one that you want. Giving B6, it's a B vitamin. Everybody thinks, oh, those B vitamins, it's going to keep my kid up. Everybody's just going to be up. It's not true. Not all B vitamins do that. And in fact, if B vitamins make you hyperexcitable, you're very deficient in them. And then but most people that have enough B6 and enough B vitamin at the very top and they're spilling over because they have therapeutic doses in their body, you can take it and go right to bed. You won't notice a thing. B6 though is calming because it helps you make GABA, it's clearing the glutamate, and it's helping with deficiencies. Lots and lots of seizure medications cause nutrient deficiencies. In fact, there's a site, it's called MyTavin, mytavin.com, that you can go to and put in whatever medication you're on, and it'll show which medicine you're depleting. Like proton pump inhibitors, Prilosec, it's one of the number 1 or 2 drugs prescribed in the world, maybe in the US for sure. And you know what it does? It depletes your B12. So it literally prevents you from absorbing B12. You know, it's really important for your kids' brains to grow is to support their B vitamins. It's essential for them to have good development. So all roads lead to the mitochondria. Do you guys remember what the mitochondria is? Yeah, everybody knows that, the powerhouse of the cell. Yeah, it's our energy factories from our cell, but they are organelles that make energy. And they're in the cell, right? So here we have that important phospholipid membrane. It's the barrier, it's the door to the house. And then if we have lipid peroxidation or stuff coming in that's making this excitatory or inflamed, eventually what's going to happen is these little mitochondria over here, it's going to get through their cellular membranes. And mitochondria, we could have another day just on the mitochondria, maybe a week. But they create oxidative stress by means of producing energy anyway, despite any injury. All of our mitochondria they're burning up our fuel. There's waste from it that's oxidative to the cell. So supporting their function is really important. And you know, the number 1 thing to give your mitochondria to rescue it, well, we've already talked about it, is essential fatty acids. Very, very important for that. But the mitochondria, when they have inflammation, they have aberrant ATP or energy production. And when the mitochondria are inflamed, it inflames the cell. And then again, you have more activation because you have an inflamed cell that dies. And then the inflammation goes on. And then all of your biochemical reserves are depleted because you have such inflammation in your brain. Somebody asked me today, well, what should I be feeding my kiddo? It's like, gosh, if anything, we should be feeding our kids lots of fat, lots of eggs, lots of animal protein, lots of B vitamin foods. So I do not ever recommend a vegan diet for anybody with any brain pathology. I think it's I think it can be dangerous. And you're missing carnitine, you're missing omegas, you're missing a lot of things. High fats and the good fats, not the oxidized fats, not the fats from, that's in the 18th ingredient on their packaged bar, not that fat. Fats from nuts and seeds and avocado and fish and the smash fish we talked about. But ubiquinol is probably the number 1 mitochondrial antioxidant that we have. In fact, we know, most cardiologists know now, if you're in heart failure, you can give your heart failure patient 600 milligrams of ubiquinol a day, and it can improve their heart failure. It can have somebody's heart that's failing come back because all of a sudden you're giving the mitochondria antioxidants and you're giving them fuel to have more energy. And you know where more mitochondria is? It is in your brain, in your heart, in your organs that produce a lot of energy all the time. We have more mitochondria within those cells. So ubiquinol is a mitochondrial antioxidant. It's a carrier between the complexes. There's this very complicated complex 1, complex 2 of how we create energy within the cells. So we know there are robust studies against many different disciplines of medicine giving ubiquinol. Honestly, in brain injury, there's not many. They're mostly animal studies, but I just think it's an underutilized area of study. I do not think it is not incredibly important. Here is Here is a graph by, it's not a graph, it's more of a list by Dr. Richard Fry. He's an MD, PhD, and he's probably the #1 pioneer in how to treat autism. Autism is medical. Autism isn't bad luck. Autism is a neuroinflammation. So you'll see here they've done studies to show what are some of the mitochondrial antioxidants that kids with autism need. And you'll see ubiquinol is at the top of the list. And for those that are already taking supplements and savvy about supplements, ubiquinone is the oxidized form of coenzyme Q10. Ubiquinol is the non-oxidized reduced form. So when you can give somebody CoQ10, you want it to be ubiquinol. Here's the problem. It's liquid. So it comes in a gel cap. So if you have a kid and you're gonna have to take that capsule and squeeze it into something to get them ubiquinol. So it's not as easy to put in supplements. It's more expensive too. And if it's ubiquinol, which you want to look for ubiquinol, it's going to come liquid. But you can see there are other things. Carnitine is huge in the mitochondria. Carnitine deficiency is huge in neurodevelopmental disorders. Carnitine comes from animal protein. That's where it comes from. If your kids aren't eating enough protein, you're going to be carnitine deficient. And it's imperative for carnitine to help shuttle fatty acids into the cell. So how do we foster growth and repair? And this is our last kind of big nugget on how we're going to help our children with neuroinflammation. Folate is imperative for growth. It's imperative to keep us all alive. If you're low, we know you have something called megablastic anemia. We also know that if you don't have enough folate when you're pregnant, you're likely to miscarry or not carry that baby to term. Folate is really interesting though. We dump a bunch of folic acid into our food source. You know, white bread has lots of folic acid in it. However, it is a synthetic form of folate. So the government knew, if we're going to improve outcomes for babies to live and not be born with part of their brains and spines, we're going to have to give them more folate. So they started supplementing it into our food supply. The problem is folic acid is synthetic and a lot of people can't break it down. So folate's important for the brain because remember those oligodendrocytes that wrap the myelin and help with myelination? It's imperative that they have enough. It plays a role in their differentiation. Folate can be disrupted coming into the brain based on inflammation in the entire body. One of the new things of research that's coming out that's very, very exciting and very imperative to the work that I do is that we're seeing that there's antibodies that are binding folate absorption into the brain. So who's heard of Hashimoto's thyroiditis? Yeah. So you're like, well, my thyroid works, but I have all these antibodies that are blocking the thyroid hormone getting into the thyroid and the cell to produce energy. There's the same thing happening with folate into the brain. You can have blocking or binding antibodies that are preventing the absorption. So if you do a folate level and you look at somebody's blood, you can see, oh, they have high levels of folate. It could be that folic acid, right? It's not methylated or broken down. And we can also tap their spines, look at their cerebral spinal fluid, and they have no folate at all getting into their brain. So it's important. Folate is needed for the mitochondria. Folate is needed to make something called glutathione, which is our master antioxidant in our brain as well. And there are genetics around folate. There are genetics even going into this. There are common variants. Do you know that 60% of humanity has an MTHFR mutation? Who's heard of MTHFR? Yeah, methylene tetrahydrofolate reductase, right? And it's all about, how do we break down that synthetic form of folic acid into the methylated form? And it's super common. That's why the geneticists are like, oh, that doesn't matter, it's common. We only look at things that are not common, and that matters if they're not common. Even if you get this huge chromosomal microarray and it comes back and you have this gene variant, they're like, oh, it's so irregular, not common at all. We don't know what to do about it. Just hold. There's no action. There's absolutely no action. You're then told your child has some rare common variant that there's nothing you can do about, basically. So we know over time, there's been enough studies, if you can't break down into those good forms of folate, you're more likely to miscarry, you're more likely to have depression, you're more likely to have all of these comorbidities with having folate deficiency. And now we also know you can do that, not break it down well, and you cannot absorb it well into the brain. So deficiencies can rise the marker of homocysteine in your blood, which is correlated with poor folate absorption. We know if we even add methylfolate to somebody taking Prozac or Lexapro, that it actually makes your antidepressant work better. And that's because our body needs folate to even make neurotransmitters. So I should have had a really geeky slide up here. It would have been a lot of fun. And I would show you that folate is a precursor to actually making your neurotransmitters. So I like to tell my patients, your neurotransmitters are like a cake, right? And we have to have eggs and sugar and flour, and we have to have all the things to have a beautiful, delicious cake. But when you're missing some of those cofactors, say you're missing your flour, your folate, you're gonna have a flat cake that doesn't taste well, and it's not gonna be what you're expecting and hoping for. So the good news is, there's part of the brain, and I didn't give a thing. Next time I will. I'll show you the reduced folate carrier. When you have folate autoimmunity or problems getting into the brain, there's one pathway called the reduced folate carrier. There's one pathway for one type of folate, and it's called folinic acid. It's not methylated folate, which your brain loves if there's no autoimmunity. Our brains love methylfolate. It's not folic acid. That's synthetic, it's folinic acid. So if my patients have this, I will prescribe them 25 milligrams twice a day of folinic acid. And then all of a sudden, they start talking. 2 or 3 months later, they'll have their first words. It's really unbelievably remarkable how imperative folinic acid can be to the brain, because folate repairs. Folate goes to your purine synthesis, is what you make your RNA and DNA, and it helps you to repair. B vitamins have always been essential in mental health. And you know, B vitamins, folate doesn't stand alone. Folate has a basket of things that help them. B12, riboflavin, which is B2, B6, we've talked about, pyridoxine 5-phosphate, and it's all needed to help your mitochondria. I have this slide up here because, you know, it's easy to go and get products off of Amazon. It's easy to go to the grocery store and just go to the vitamin aisle. It's easy, and I totally get that. But I've been in the supplement industry a while. And let me tell you, there's some shady stuff out there. So the government doesn't regulate vitamins. Did you know that? There's a Good Manufacturing Practice Act that says, hey, in order to make a vitamin, you really need to check these boxes. And it's up to said manufacturer to tell them that they have done it. That's the law. So what you always want is somebody that's had a third-party product testing and verification to come through your facility and say, oh, you checked this box, oh, you checked this box, oh, you checked this box. I was just in California visiting our manufacturer a couple of weeks ago, and they run our bulk product through 7 machines to get out heavy metals. 7. It's part of the process. And they had just had one of their inspections from the government. So you want to look for things that are third-party product testing and validated. It's important. You're not going to find that on a lot of things that are using cheap ingredients like folic acid, non-forms of magnesium that doesn't get to the brain. You got to be smart about it. It's an investment to put your kids on supplements. You want to be able to do it right. And if you get a good product and you know what the ingredients are and how to use them, they're more likely to work. So, it's very multifactorial, isn't it? Restoring the brain. Supplements can help. Fatty acids can help. Magnesium can help. Folate can help. Plasmalogens can help. It all can be very, very impactful. And this is the thing that I want you to remember. It's not an Advil effect. So if you go get a B12 injection and you're like, woohoo, 45 minutes, my gosh, you needed that B12. Because remember, you were really deficient in it in the first place. But most of the time, you don't see a lot right at first. And so what breaks my heart is people don't get in it for the long term of it. And not long term, like I did it for 5 years and it didn't work. I'm talking 3 months. Give it 3 months. Give something 3 months and be very, very, very consistent with it, and you will see change. In all of my patients, and Alexis is here with me today, she can attest to this, we see improvements. The degree to the improvement varies within all the patients. Whether it's they slept through the night, they said their first words, they had the capacity, their skin got better, they quit vomiting, etc. People do get better, but you have to hang in there and be consistent as their parent. And I really wanted to leave you guys with this. So this is an English, I think he's a French philosopher. He said, "Follow those who seek the truth, but flee from those who have found it." I've been doing this resource fair. I think today is probably my fourth time I've spoken here. And there's all these people out there that can help you. They have different modalities. They have different leans on things. This is a fair saying, how can we come together collectively and help improve your family and your child's situation? But I warn you, anybody that thinks they have it 100% and 100% right, beware. I would flee from those people. We are all learning. We are all learning all the time. And everybody has something valuable to add. So go with your gut. You have lots of choices. Feel what's right for you and for your family. And no, not everybody has it perfect. It just doesn't exist. But we're all trying. And I'm glad to be here today. So thank you very much. I think that's it. I wonder if we have any time for questions? Yes, ma'am.